Symptoms of an overactive thyroid. Hyperthyroidism. A small butterfly-shaped gland sits in your neck. It is called the thyroid. This tiny gland works hard to control how your body uses energy. It makes hormones that affect almost every part of your body. But sometimes it makes too much of these hormones. When that happens, doctors call it hyperthyroidism, or an overactive thyroid. When the thyroid makes too many hormones, your body runs faster than normal. It is like pressing down on the gas pedal all the time. Everything speeds up. Your heartbeat, your thoughts, and even how quickly you burn food for energy. This may sound good at first. You might think more energy means feeling strong, but your body can't keep up when it runs too fast. That is when problems start to show. Number 1. People with hyperthyroidism often lose weight without trying. They eat the same amount of food or even more, but their body burns everything too quickly. Research says around 1 in every 100 people will develop hyperthyroidism at some point in their lives. It can happen to anyone, but it is more common in women than in men. Women are about 5 to 10 times more likely to have an overactive thyroid. Number 2. Many people first notice changes in how they feel. Their heart beats too fast, sometimes over 100 beats per minute even when resting. Some people say their hearts flutter or feel like they are skipping a beat. These are called palpitations. The fast heartbeat can make you feel short of breath or tired. But resting does not always help because the body keeps running at full speed. Number 3. People often feel nervous, anxious, or on edge. It's not the same as normal stress. It feels like your body cannot relax. You may feel jittery for no reason. Some people notice that their hands shake slightly, especially when they try to hold something still. These tremors are common and happen because the muscles are too active. Number 4. Sleep can also become a problem. You may find it hard to fall asleep, or you wake up in the middle of the night feeling restless. Even when you manage to sleep, you might not feel refreshed. The body needs calm to rest, but hyperthyroidism keeps it wired up all the time. There are 6 more signs to go, but remember to like and subscribe if you think this video is worth. Number 5. People with an overactive thyroid often feel hotter than everyone else. You might sweat more than usual, even in cool weather. Some say they can't stay in a warm room for long because it feels uncomfortable. Their skin may feel warm and moist most of the time. Number 6. Muscle weakness is another common sign. Climbing stairs, lifting objects, or even getting up from a chair can feel harder. The muscles, especially in the arms and thighs, get tired easily because the body burns energy too quickly. Number 7. Your digestion can also change. Many people notice they need to use the bathroom more often. Some experience loose stools or even mild diarrhea. But not everyone has this symptom. Each person's body reacts differently. Number 8. Women may see changes in their menstrual periods. Periods might become lighter or come less often than before. But this can also vary depending on age and other health factors. Number 9. One thing that can be quite noticeable is a swelling in the neck. This happens when the thyroid gland itself gets bigger. Doctors call this a goiter. Sometimes it is just a small swelling, but in other cases it is clearly visible and can make swallowing feel a bit strange. Number 10. In some people, especially those with a condition called Graves' disease, the eyes can be affected. The tissues behind the eyes swell up. This can make the eyes look like they are bulging forward. Some people have dry eyes, redness, or vision problems. The eyelids might not close properly when sleeping, which can make the eyes even drier. But not everyone with hyperthyroidism has this issue. Graves' disease is the most common cause of hyperthyroidism. It is an autoimmune condition, which means the body's defense system gets confused and makes the thyroid work too much. About 70% of cases of overactive thyroid are caused by Graves' disease, according to medical research. Other causes include nodules, which are small lumps in the thyroid that make extra hormone. Sometimes, certain medicines or even too much iodine in the diet can trigger it. If you think you might have hyperthyroidism, it is important to see a doctor. A doctor will usually ask about your symptoms, check your neck, and run a simple blood test. This test measures how much thyroid hormone is in your blood. The main hormones are called T3 and T4. There is also a test called TSH, which measures a signal from the brain that tells the thyroid how much hormone to make. When T3 and T4 are high and TSH is low, it usually means the thyroid is overactive. But doctors will also look at your symptoms and other test results to be sure. The good news is hyperthyroidism can be treated. Treatment depends on what's causing it and how severe it is. The three main treatments are medicine, radioactive iodine, and surgery. Medicine can help control how much hormone the thyroid makes. One common group is called anti-thyroid medicines, which help slow down the thyroid. Most people start to feel better after a few weeks of treatment, but it can take a few months for hormone levels to return to normal. Research shows that with regular treatment, many people feel much better and live normal, healthy lives. Radioactive iodine is another common treatment, especially for adults. It works by shrinking the thyroid gland slowly over time. It's taken as a small drink or capsule. The dose is small and safe for most people. But pregnant women do not take this treatment because it could affect the baby's thyroid. In some cases, surgery might be needed. This is usually chosen if other treatments are not suitable or if the thyroid gland is very large and causing pressure on the throat. After surgery, some people need thyroid hormone tablets for life because their gland no longer makes enough hormones on its own. Treating hyperthyroidism can also help with symptoms like anxiety, sweating, and tremors. But recovery takes time. The body needs to return to its normal rhythm. During treatment, doctors often check blood tests every few weeks or months to make sure hormone levels are balanced. Living with hyperthyroidism can be challenging, but there are things you can do to help yourself. Eating well, getting enough rest, and avoiding too much caffeine can help reduce symptoms like nervousness and a racing heart. Sometimes people find relaxation methods like gentle yoga or breathing exercises help calm their body. But these should not replace medical treatment. It's important to keep follow-up appointments and tell your doctor if you notice any changes. With the right treatment and care, most people with an overactive thyroid can live healthy, active lives. The key is catching it early and knowing the signs. So if your heart feels like it is racing, you are losing weight without trying, or you feel hot and restless all the time, don't ignore it. These could be signs that your thyroid is working too much. Talk to your doctor. A small test and the right treatment can make a big difference to how you feel every day. Please like and subscribe if you think this video is worth it. It is a great help you can do free of charge.